But first at 4:30, we're digging into the skyrocketing drug prices after the price of the EpiPen launched a national controversy.
The makers of the life-saving allergy treatment increased the cost of the product to about $600 for a 2-pack, and that is up about $100 from 2009.
But this issue isn't limited to just EpiPens. Charlie Etzedy joins us live from Chandler to explain why this trend is putting some patients in a life or death situation.
Kribe, it's a very complex issue when it comes to explaining how manufacturers price their products, but as it stands in the United States, we actually don't have any kind of oversight that would have prevented what we saw happen with the EpiPen.
It's really saddening to look at their faces, and they know what they're supposed to do. They know that they need the medications, and yet they can't afford it.
Dr. Andrew Carroll has been practicing medicine for over 20 years and has watched the price tag for certain prescription medications rise for his patients.
And they're forced to make choices that they should not have to make. We really should be providing a robust healthcare system for these folks. I thought that this was what this was all about.
Dr. Carroll says he pays about $1 for this bottle of epinephrine, but it's a $600 price tag for the branded EpiPen that uses the same drug but is packaged inside an injector.
In the United States, there's no price regulation for pharmaceuticals. Manufacturers are able to request a price however they choose.
Sky-high prices are caused for a variety of reasons. Some manufacturers say they've got to cover the costs for the research behind the meds and also the trials that didn't pan out. Other reasons include the lack of competition for consumers if there are no generic or cheaper versions of the branded product. And some of the country's strict quality standards can also prevent any generic brands from reaching consumers.
Historically speaking, we've had multiple manufacturers wanting to make these medications, but lots of reasons we're seeing generic manufacturers focus on specific products or product lines and not crossing over and competing against other generic manufacturers.
And another piece of information that Dan shared with me was that generic manufacturers could be the solution to this problem if they're allowed to create cheaper versions of the branded products. But the FDA says that there's actually a huge backlog with applications for generic manufacturers to do that. And the FDA also says that they actually don't have enough manpower to get through and approve those applications. So, guys, I'm going to toss it back to you in Phoenix. We're live from Chandler. Charlie Etzedy, 12 News.
All right, Charlie, thank you for giving us some perspective on that process. And, after all the controversy and negative reaction to the EpiPen price increases, Mylan, the company that sells the drug, announced a generic version will be available in a few weeks. The generic will cost $300, which is half of what the brand name costs. They say it will basically be identical to that brand name version. Many of you have probably wondered, is a brand name medication better than a generic drug? Here's the answer. The FDA requires the active ingredients, the strength, the dosage, all of that, and the route of administration to be the same in the brand name drug and the generic drug. But here's where they differ. The FDA says they do not have to contain the same inactive ingredients. The drugs have to look different, so the inactive ingredients are products like color additives, for example. Studies have shown that generic drugs work just as effectively as brand name drugs. Doctors often prescribe them because they're cheaper and often preferred by insurance companies. The bottom line is it comes down to how much you want to spend and how that drug is absorbed in your body.